This is Tom Lee, Editor-in-Chief for NEJM Catalyst, and today our focus is on the unstable healthcare workforce and organizational culture. How can we preserve safety and improve morale during a time when turnover is so high and most organizations are relying upon travelers and other organizations are still using plenty of temporary personnel just to keep the lights on? We're talking with two experienced and thoughtful leaders, Gary Kaplan, board trustee from Common Spirit Health, and until recently, the longtime leader of Virginia Mason Medical Center, and Della Lynn from the board of the Anesthesia Patient and Safety Foundation, who has played a variety of other roles as a leader in quality and safety. They've been thinking about the various pressures on the workforce, which don't really need recapping for this audience. But they have some clear and valuable thoughts on how the critical pressures in the workforce impact patient safety and culture and what to do about it. Gary, let's start with a simple question. Who are these gig workers and how do you categorize them?
Well, thanks, Tom, and it's great to be with you today. I think we've had this mindset that it was kind of a homogeneous group of individuals, but in fact, not all gig workers are alike, and they're actually a quite heterogeneous group. McKinsey has actually taken a stab at trying to characterize them for us, and I think the ones we think about most commonly are the free agent gig workers. These are people who previously may have had careers in established organizations. They maybe had a bad experience and decided, maybe I can find a more flexible, different way of working. And that represents about 30% of the gig workers. There's also three other categories that McKinsey identified, and would start with, say, the reluctant a gig worker. These are people who left an organization, perhaps it wasn't a good fit, or they felt a need to do something different, and the gig worker concept just kind of fell in their lap. But I think they would be quite willing potentially to go back into organizational life in a different setting. There's also, obviously, particularly in today's environment, the financially strapped individual who might prefer full-time work and yet realize during the past few years that they could actually be more financially satisfied, make more money, and have the flexibility that comes with being a gig worker. That was only in their assessment, 16%. And then finally, the casual gig worker who kind of just wants to pick up some extra money. It's much easier to do that on a gig basis than trying to arrange those kinds of work situations within an existing organization. And so these categories are interesting. And yet when Della and I looked at them in some detail, we realized that all four categories lend themselves to potentially becoming loyal, committed team players on a permanent and perhaps full-time basis. But it's how the organization approaches each of these that I think is most instructive and has the most potential to add high-quality permanent staff to one's organization.
Well, Gary, one of the great things about you, or two of the great things, are that your feet are on the ground, but you are an optimist, and your last comments are consistent with both. But Della, let me turn to you next and say that it often seems like people are blaming everything that could go wrong on transient workers. But what do we actually know about their impact on safety, quality, and culture?
So Tom, thank you for having us here today. And, we've heard a lot, right, about workforce challenges as being the crushing #1 problem for hospital these days. And so I think this is a provocative question for us. Does having a gig economy workforce, and is there an inflection point, have an impact, and how much of an impact on patient safety, quality, and culture? So my bias is yes, it does. And that a big piece of this is that we tend to think of this workforce challenge as a transactional challenge, but our organizations are simultaneously social and technical systems. So this is a relational relationship challenge. You know, we often say, kind of quote unquote, how do we do things here? That's what culture is. But at a granular level, it's really, how do we problem solve here? How do we manage conflict? How do we come to decisions? How do we identify failures, both catastrophic and ordinary? And how do we respond to ambiguity? So thinking about these important intersections and where we operate, having even a small number of temporary staff on a team, I think can have important implications and fresh challenges on culture. So as far as the actual aggregate data goes, kind of a mixed bag. So there's a study out there from Johns Hopkins that they used national MedMarks data, and they concluded that ED medication errors were more likely to reach the patient with temporary staff than permanent staff. It's actually an odds ratio of 1.4. A different longitudinal population study found hazard of death increased incrementally for each day a patient had temporary RN staff care. And then I'll mention a third study, over 100 hospitals, that suggested an inflection point, so reflecting kind of what I just said earlier, of increased harm when units were staffed with more than 15% temporary staff. But to be fair, in contrast, there are other multi-hospital aggregate studies that have shown that units with agency-employed temporary RNs do not show differences in mortality or failure to rescue, especially when the data is normalized for the work environment. So in the end, my bias is yes, but. Yes, but, because it doesn't have to be a negative effect. I think that depends on how organizations frame and manage this.
Well, you know, what you say is very consistent with what I've seen in my my work in my other job, working at Press Ganey, where, you know, we know that, yes, it may be true that having, you know, a large percentage of temporary staff is not as good as having 100% full-time regular people, but it's better than having inadequate staffing. So I think your yes, but framing is, you know, very much the right attitude. Now, since we're likely to be living with gig workers for the foreseeable future, what do we do? And I very much like the 6-component model that you two have framed. And so I'd love for you to explain it for our audience here. What the letters are, the 6 letters in RETOOL, RETOOL. So I'm wondering if you can tick through them for our audience. You know, Gary, if you can go first, what does the R stand for?
Sure, happy to do that. And you know, even we optimists understand that it's about execution, and so how we behave as an organization will determine whether or not we're able to attract and retain these gig workers on a more permanent basis. And so we started with reimagine. And when we talk about reimagine, we're really talking about onboarding and recruitment. Gig workers, it turns out, follow quite a different path in their onboarding. In fact, just as some of us have thought that maybe the temporary travelers have a little bit more of a freelancing attitude, I think we in organizational life have also taken a bit of an attitude. And we send our gig workers to security, get their ID badge, get their set up on the EHR, learn a little bit about the IT, and we shorten and abridge the onboarding process as much as possible, because the name of the game is getting these people on the front lines where they're badly needed. And so we think that reimagining an onboarding process that's universal, that applies to everyone, that is values driven, both the individual's values and the organization's values, and helping people to understand the culture, the environment that they're being part of, and the importance in many of our organizations about giving agency to that gig worker. So not calling them a short timer, you're just filling a slot, but we want you to be a team member. We want to orient you so that you're able to be a team member, and we always want your best thinking. Be an active idea generator for whatever time you're with us in this organization. So how we approach them on day one will be critically important.
Well, that onboarding process for temporary workers is, I think, quite different from what most places are doing. But let's suppose you've done that. Della, what comes next? The next letter is E, I know, but what does E stand for, and what follows after the onboarding?
Right. So E stands for engage, maybe a bit of a buzzword, but in this, we're sort of asking the important question, how and where might we intentionally think about engaging with the gig worker? And to Gary's point, really everybody, how might we rethink about after the onboarding process? So we have two suggestions, something we've called middle boarding and the buddy system. So what is middle boarding? So like it might sound, it's not onboarding and it's not offboarding. Research actually suggests that at 3 months, people begin to reflect and make decisions, whether to stay or leave. So how might HR and leaders tune in to this 3-month milestone? Intentionally middle boarding at that 3 months could be a potentially powerful win-win, providing active listening and active feedback to the hire, as well as provide learning insights for the leaders. And then our second one is to intentionally engage by employing a buddy system for all employees. It's basically a takeoff from what the military implements with their battle buddies, which they put in place for performance and safety and well-being. So a buddy system facilitates onboarding and a sense of connection, a relationship with organizational life and with the organization. We actually encouraged buddying up with a battle buddy during COVID when the emotional and physical and isolation of work was huge. So those are at least two things we're thinking about for that letter E.
Well, that's really interesting. I mean, it's like giving a bolus medication, after the initial loading dose, which I'm sure most people have not done. All right, so Della, the next letter is T. Is this something beyond the buddying that you're talking about?
Right. So teaming, and I'll describe that a little bit later here, but it's a term that Amy Edmondson coined. But this is our reflection of what does our middle bench of leaders, managers, and supervisors look like when it comes to having those essential skills of psychological safety and inclusiveness. What do our managers and supervisors, how are their essential skills around being open to showing vulnerability? What are our leaders and, again, managers, supervisors, the essential skills around their tolerance, their true tolerance for ambiguity? So successful teaming means nurturing and building this middle bench. So where am I going with this? There is supporting data today that team consistency correlates with improved outcomes. In the operating room, where I often live as an anesthesiologist, this can mean improved long-term morbidity outcomes. It can mean shorter OR times. It can mean reduced 30-day readmissions and costs. So stable teams develop and create a meta memory. It helps them with their information sharing, implicit, explicit coordination, decision-making, dynamic learning. So when we have high turnover and we have gig workers, we don't have the luxury of meta memory. So we have to step up our game to this concept of teaming, something, as I said, Amy Edmondson coined and basically defined as teamwork on the fly. So as opposed to teams, teaming is a verb. And at the center core, successful teaming actively practices psychological safety. And I would say psychological safety on steroids. So basically, a gig worker, or really anybody, but we're focusing on this conversation about the gig worker, needs to feel like they can come to work and be included, they can contribute, and they can challenge if needed without being shut down. So one of my favorite questions for a new gig worker in the OR is, what's something that has puzzled you about how we do things since you've been here?
That is a really interesting set of ideas. And of course, I'm sure many of our audience members are thinking we should be doing that for everyone in our workforce, but especially making it an activity that happens for our gig workers is definitely a new idea and an intriguing one. So Della, the next letter is O.
Right, it's the first of our two O's in RETOOL. So this first O is overlooked. And overlooked means don't overlook your own strengths. So the question here is, how might we create an in-house gig experience? So if you're a system, can you create an in-house travel staffing program where staff stay within your system but can match to a varied experience, like another hospital or another geography within your system? Another example would be, do you have the flexibility and creativity to create what we call soft landing jobs, ones where if it doesn't work out for the individual, they can actually return to their existing role. So it gives them the agency for experimentation and growth. And then a third idea is, can we be flexible enough to create sort of, let's say, short-term, high-intensity opportunities for staff approaching retirement? So instead of retiring and losing that individual to being a freelance gig worker somewhere else, they actually stay within our organization. So in the end, overlooked means take a step back and ask, how might we?
Okay, Gary, the second O is yours.
Yeah. Well, first of all, we termed the O obviously to make the mnemonic work, but it's an overarching learning culture is what we wanted to emphasize. We have in healthcare cultural challenges. And one of the things we've found is that an environment that empowers frontline caregivers, that gives them agency, as I mentioned earlier, to innovate. One of the things we learned, as you know, Tom, at Virginia Mason over the years with our Virginia Mason production system, was the people closest to the work are best able to understand where the defects are, where the opportunities for improvement are, and where the innovation can occur. And it's having a system in place, a culture in place, where that is the way forward. And when a new team member enters that culture, more often than not, they will say, wow, people really care what we say around here. People really want to know what the so-called rocks in our shoes are. And we used to say that team members have two jobs: run your business and improve your business. So that creating that learning environment, robust feedback loops, places where staff feel very engaged, and it fits together into a learning cycle. And engaging traveling staff, and we've had some experience with this at Virginia Mason in our improvement work, was really something that I think developed a tremendous affinity and has led to some people remaining long-term with the organization. So how do we acculturate and bring the same benefits that come to full-time workers in terms of what they're able to do and in their work? And most of us want to work in an environment where we feel a sense of some control, and that learning culture is a great way to do that. Then leads to a better way forward for patients and for staff.
Okay, and Gary, the last letter is L, and I can guess what that stands for.
Yes, you know me very well, Tom, and you know that I believe that leadership is a fundamental, absolutely necessary part of a successful organization. And it's the leaders in the organization that it really set the culture. And for this discussion, it's the leaders that will determine whether an organization is aligned and tremendous and focused on safety, for example, or on quality. It's not just identifying it as a goal, espousing it. Everybody here, we're going to work on quality and safety, but it's walking the talk. And it's, in fact, as Edgar Schein says, the cultural organizational culture guru, who both Del and I came to know quite well, it's the leader behavior. And the most important thing leaders do is attend to culture. So it all comes back to this learning culture, leaders establishing it and reinforcing it at every opportunity, transparency being embedded in how we do our work. And the result is an empowered workforce that feels like they're coming to work every day with the ability to make a difference in the lives of the people we serve. And that's why we all went into medicine. And so we think that this is this simple mnemonic and the behaviors attached to it can really help take what has been for many a costly and somewhat frustrating gig economy and turn it into something really special in organizational life. It's an opportunity that's in front of us in all of our organizations across the country.
Well, Gary and Della, I want to thank you for your work articulating this. As you probably know, I love when people can create frameworks for taking on challenges that may seem overwhelming and in their complexity. And the framework may not be perfect. It hasn't been tested in randomized trials, but it gives people a way to approach their work and come on in on Monday and plunge in. Actually, as you were speaking, I was thinking of a model that my colleague and co-chair of the board for NEJM Catalyst, Michael Porter, laid out early in his career, thinking of strategy as, what the value you're creating for a customer. The customer here is the gig worker, and the value you're creating is making an organization a better place for them and make them want to stay. And the next thing that Porter laid out was the concept of the value chain of activities. And you're laying out a set of 6 activities that ought to be focuses for organizations if you want to try to create that value for gig workers. Doing one of them is not enough. Doing 2 of them is not enough. But if you're doing all of them, I think that you've got a much better shot at holding on to your personnel and thriving because of that. So thank you so much. I know this won't be the last thoughtful contribution from you both, and I'll look forward to the next one.
We will as well.
Yeah, thank you.
Thanks so much for having us, and thanks for the great work you are doing, Tom, and all of the team at NEJM Catalyst.
I echo that. Thank you so much, Tom.